So I wanted to talk to you today about a very common problem, or tennis elbow. The fancy name for that, or the medical name, is lateral epicondylitis. It is one of the more common things that we see, but it's also one of the more recalcitrant or difficult problems to solve because it tends to stick around. There's really no quick fix to this problem. Of course, we can give you a steroid injection, and sometimes we can get lucky and that'll fix the problem. However, the usual course and the mainstay of treatment is occupational therapy. Why is that? Ultimately, tennis elbow is partial tearing of the tendon of the elbow, or tendinosis. And basically, the body is not healing this area, and so we need to stimulate the body to heal. So anything that we're doing is trying to rehab and get the body to heal itself. Now, once we've gotten past the injections and the therapy and those things haven't worked, and most of the time they do work, but there are surgical procedures that we do. One of the more invasive or minimally invasive procedures that we do is called the 10X procedure. It's where we use an ultrasound to guide us in a special probe to heat up the tissue and then allow it to heal. And it's a very, very small incision. You barely get a Band-Aid for that. There is rehab for it, but it's very simple, straightforward outpatient procedure. Also, if all of those things fail and you get to the point where you actually need surgery, tennis elbow surgery is pretty straightforward. We kind of go in and clean up the tissue, so the incision's pretty small once we get down to it. But ultimately, the vast majority of cases will be treated with the short course of therapy, maybe a steroid injection and a brace. If you get to surgery, we usually start with 10X procedure. And if the 10X doesn't work, then we do an open lateral release. So hopefully that gives you some idea of how we can treat this problem.